Thank you, Elizabeth. Good afternoon, everyone, and thank you for joining us. Throughout the COVID-19 pandemic, DHS has been committed to transparency in the data that we receive from our 98 local and tribal health departments. And part of that commitment, means providing data to the public in real time. Data is the tool that drives decisions for public health, and it has remained vitally important to inform our decision-making process throughout the COVID-19 pandemic. As of today, there are 272 new confirmed cases of COVID-19 in Wisconsin, which brings our total confirmed cases to 609,561. Our 7-day average of confirmed cases is 282. There are also 37 more Wisconsinites who have died from COVID-19, bringing our total deaths to 7,040. Our thoughts are with the families and friends who have lost loved ones from this deadly virus over the past 15 months. We continue to build on our efforts to get Wisconsinites vaccinated. As of today, 5,111,247 doses of COVID-19 vaccine have been administered to date, and 2,416,757 residents have completed their vaccine series. We will continue to provide our COVID-19 data in real time to help keep Wisconsinites informed on the state of the pandemic. It is so important for all of us to remember that these numbers represent real people. Each COVID-19 case is a person whose life changed because of this virus. At DHS, we are dedicated to COVID-19 surveillance because these numbers help guide our decision-making so we can prevent future illnesses and death from COVID-19. Our data also highlights our shared accomplishments as a state through our growing vaccination rates and decreasing case rates. As the pandemic evolves, we will continue to tell the story through our data. And today, we at DHS would like to share some exciting improvements that we have made to our COVID-19 data. Today, we released the updated Wisconsin Summary Statistics Dashboard, which provides an at-a-glance view of important COVID-19 information for Wisconsin. The dashboard now includes vaccination rates and COVID-19 disease activity, as well as case and death metrics that use 7-day averages. These 7-day averages help smooth out day-to-day fluctuations in our data that may occur due to testing and reporting patterns. In addition to the updates to the summary dashboard, we have updated the data feed for several of the visualizations on the COVID-19 data pages. To make our data more precise, we have improved our method of reporting daily new confirmed and probable cases and new reported deaths, so they are not impacted by ongoing data cleaning and quality assurance efforts. This prevents daily COVID-19 case and death data from appearing artificially low or even negative, and gives a more accurate account of daily numbers across Wisconsin. As we move forward with these updates, we will also be moving to a 5-day per week schedule for our data updates, so you can look for new data on the DHS website on a Monday through Friday schedule. Disease surveillance work, including data quality assurance, is a dynamic process, and it is an important part of providing complete COVID-19 case and death data. Our efforts reflect a continued commitment to high data integrity and transparent real-time COVID-19 data. DHS will continue to provide updates on these efforts and how they will enhance COVID-19 data quality in Wisconsin. And now I'm going to do a short walkthrough of our new summary statistics dashboard for you to highlight some of the new features. All right, so hopefully everyone now is seeing our Wisconsin COVID-19 Summary Statistics Dashboard. And this is on the main summary data page if you're looking for this piece, this new piece of data. So a couple of highlights here, things that we've added to really give you an at-a-glance for our data. We've added a quick at-a-glance for the case activity information, which is normally on our case activity dashboard. And so you can see as this data has been updated, we now have 57 counties that are at that high level, 14 counties that are at the medium disease activity level, and 1 county that has actually moved into the low case activity level. And as I move across this, you'll notice that as with all of our other dashboards on the DHS website, each of these has nice hover features so you can get additional information as you move through the dashboard. We also wanted to make sure that we provided an at-a-glance some information on our vaccines. So we have the vaccine information here up on the top, and we have 47.4% of residents who've received at least one dose of vaccine, and 41.5% of our residents who have completed the vaccine series. So you can come here for a quick glance of that vaccine information. And also, I'll note that if you were to hover over this and click, it would take you to the vaccine data page if you click on vaccines. That's true for all of these pieces. And then we've updated our testing information as well. A couple things I mentioned already, that we have moved to providing 7-day averages for our new cases. And it looks like maybe we're seeing some real-time updates here. We're up to 285 as our 7-day average for confirmed cases. And then we've also added here on our at-a-glance the new probable cases. And so 55 is our 7-day average of new probable cases. And as I hover over this, you'll see, maybe for the confirmed cases, we can look first. You can see there, that's the total number, the 609,561 total confirmed cases is there, and 282 newly reported confirmed cases, and our 7-day average is 285. And then we also have at a glance for percent positive by test. You can still scroll down on this page and see the full view of the percent positive by test, but we did provide this at a glance here for you as well. And then the other change is that we've updated the information that we're providing here about deaths. So at a glance, you'll have the total number of confirmed deaths over the course of the pandemic. And you may have noticed that this number has gone up from yesterday. We had an increase of 37 from yesterday's number of 7,003. And you may also have noticed that I said we only had 4 newly reported deaths. So what's happened here is that over the course of the past few days, we've had some data cleaning efforts that have been happening at our local and tribal health departments, as well as at DHS. And the vast majority of those 37 are actually older deaths that we have found on quality assurance and have now been added to our confirmed case numbers. So that does not reflect 37 new deaths from yesterday to today. You can also see here at a glance the total number of probable deaths over the course of the pandemic. And if you will go to the chart below first, I want to point out that you can hover over this chart as well and see the number of confirmed and probable deaths on any given date. And this is actually using date of death. So this is the most accurate way to look at where those deaths really happened. So as you hover over, you'll see the number of deaths that occurred on a particular date. And you'll notice then as you get out sort of on the tail of the curve here, we do have the asterisk letting you know that the data that is newer is preliminary because there is a lag in death data reporting. And then the other piece that we have up here in the corner is now the average, the 7-day average for number of new deaths reported. And so our 7-day average is currently 2 deaths per day, and this includes confirmed and probable deaths. And if you hover over this as well, you'll be able to see that there are 3 new confirmed deaths. It will, when we hit the 2 o'clock update here in a few minutes, that will update to 4. So this is still yesterday's data, but 3 new confirmed deaths and no new probable deaths yesterday. And that the 7-day average right now is 2 deaths per day. And we also have a note here that this calculation of the 7-day average is only looking at deaths in the past 30 days. So if a death is newly reported to us that occurred more than 30 days ago, we aren't including that here. We really want this to reflect what the current burden of deaths are in Wisconsin. So you can keep that in mind as you look at that number. And with that, I think I will turn it back to Elizabeth and we can take questions.
Thank you, Tracy. And a reminder to everyone, to maintain audio quality, we'd ask you to remain muted until it's time to ask your question. Then you can use *6 to mute and unmute your phone. And let's begin right now with Heather Poltrock at WSAW in Wausau. Heather.
Hi, I'm filling in for Heather today. So one of the questions that we asked, or that we were wondering, we're seeing some places offering, sweep, since our numbers are kind of, not going up as high as far as vaccinations rates as much as we would like. Some places and some states are offering sweepstakes for people to get vaccinated. Has that ever been a discussion in Wisconsin to help pick up the vaccination rate?
That is something that we are happy to get back to you about. Today, we really want to focus on this data and surveillance, which we have just unveiled today. So if you want to go ahead and email DHS Media, we are happy to get you some information about that question. But let's focus on the data and the surveillance, which is why we have Tracy and Dr. Westergaard here. And let's move on to Rob Sussman at WTAQ in Green Bay. Rob Sussman.
Yeah, thanks for taking my question. I'm wondering if the demographics of the people who are dying from COVID-19 have changed in recent months. I know that the 65-plus demographic is very largely vaccinated, so I'm wondering if there have been any shifts in any of the demographic information in regards to who is getting and who's dying from COVID-19 right now.
Sure, and we can actually, if you want to send that in, we're happy to. If there's a certain subset of data, we're happy to look into that a little bit more for you specifically. We haven't seen a real large shift in who is dying from COVID-19. What we have seen actually is just a decrease, as we're seeing a decrease in cases. As more people are getting vaccinated, we're seeing fewer cases and fewer deaths from COVID-19, but no major shifts in the demographics to share at this point.
Wonderful, thank you. Let's give the next question now to Stephanie Hoff at WisPolitics. Stephanie Hoff.
Hi, thanks for taking my call this afternoon. So I'm wondering, we're approaching a big holiday weekend. A family likes to get together. People like to drink a lot and hang out in groups. And so I'm just wondering, especially places where people are not getting vaccinated as much as other places, if you're expecting maybe a surge among areas that are less vaccinated.
Good afternoon. I'm Ryan Westergaard here. I can start by taking that one. So, what our message about how to prevent COVID-19 transmission in communities and in families and in gatherings has not changed at all. Among people who are not vaccinated, the most important things to do are to avoid gatherings and to wear masks when you're in public. As everyone's aware, I'm sure we've become more and more confident in the level of protection that vaccines can provide. And so just 2 weeks ago, the CDC, with a fair amount of media attention, announced that fully vaccinated people can feel more comfortable not wearing masks while they're out in public. But the public health recommendations for people who have not yet been fully vaccinated remain the same. So our recommendation for people who are gathering over the holiday weekend is to do all the things that we've been recommending throughout, which is to maintain social distancing, wear masks if you're in crowd, and particularly this weekend, hopefully the weather will be nice. Gather outdoors is safer than gathering indoors.
Thank you for that. Let's give the next question now to Joshua Pagero, WBAY in Green Bay. Joshua Pagero. WBAY in Green Bay. *6 will mute and unmute your phone. All right, why don't we go ahead and try to connect with Todd Richmond at the Associated Press. Todd Richmond. Associated Press. All right, we'll try to get back to Todd, and let's move on to Wisconsin Health News. Sean Kirkby at the Wisconsin Health News.
Hi, thanks for doing this today. Just was wondering, could you talk a little bit about what your future data cleaning and quality assurance efforts are going to be? There was a mention in the press release about focusing on cases in group housing, deaths, cases by race and ethnicity. Just kind of want to know what your future plans were. Thanks.
Sure. Thanks for bringing that up. So, yep, we are doing some cleaning now actively on those cases that live in group housing. And you may remember we did similar cleanup 6 or 8 weeks ago on the deaths in group housing. So that's a continuation of those efforts to make sure that we are providing good data on group housing setting. And we are also working on doing some cleanup of our race and ethnicity data to provide the most accurate data that we can using data that's in WEDS. And another piece that we're going to be doing is looking to clean up those unknowns for healthcare workers as well. So where we can identify that someone is a healthcare worker and reduce the number of unknowns, we're going to be undertaking that effort next.
Wonderful, thank you for that. Let's go now to Ben Krumholtz, WLUK in Green Bay. Ben, Fox 11 in Green Bay.
Hi, thank you. Can you just explain a little bit why there will no longer be updates on the weekend?
Sure. So we're really making this change to be in alignment with what many of our partners are doing and CDC is doing, moving to that 5-day per week schedule. And hopefully giving some of our data staff a rest. We have staff who've been doing these updates now 7 days a week for 15 months. And so we're glad to be able to be in a place with the pandemic and with the changes that we're seeing on a daily basis to move to a 5-day per week schedule for the updates.
Wonderful, thank you for that. Madeline Anderson, WITI in Milwaukee. Madeline Anderson. Fox 6 in Milwaukee. *6 will mute and unmute your phone. All right, we'll try to get back to Madeline. And let's go now to Maria Lisignoli at WMTV in Madison. WMTV in Madison. All right, how about WISN in Milwaukee? Nick Bohr, WISN in Milwaukee.
Good afternoon. I had a question about the philosophy about reporting. Whether there might be a point at which you report how many people are vaccinated versus how many aren't who are becoming positive. So some places are doing this where they report only cases where people haven't been vaccinated or make it clear about how many have been vaccinated and how many haven't. Is that something that Wisconsin is looking into?
So we don't have any immediate plans to include that piece of data on our website. But certainly something that we, can take into consideration as we are hearing requests for new types of data. We're always looking to be telling the best picture of the pandemic in Wisconsin and to be providing the data that people would like to see.
Thank you for that. Let's give the next question now to Eric Crest at NBC 26 in Green Bay. Eric Crest, NBC 26.
Hi, John Erickson sitting in for Eric Crest. A question for Dr. Westergaard. Dr. Westergaard, earlier on in the pandemic, you and many other public health officials said you could take the confirmed cases, multiply it by 10 to get true number of infections. If it's not that high anymore, what's your estimate of the percentage of natural infections and vaccinations to get an estimate of where we are in herd immunity right now? Thank you.
So thanks for that question. There's a couple of sources of data now that we didn't have a year ago that can address that. There's been a few different sources of population-based seroprevalence studies. And what I mean by that is we can look at blood that has been collected from people in healthcare settings or in blood donation settings, test that blood in the laboratory to see how many people have evidence of prior infection, because most people develop antibodies to the virus after they recover from infection. The CDC has supported a large nationwide study called the MASS-C study. They report these data on their COVID data tracker. And Wisconsin, at the last I checked, you can look up for the precise number if you want to quote me, but it's been in the ballpark of 30 to 34% of specimens from or individuals providing blood specimens for diagnostic purposes had positive antibodies. So that's not probably perfectly accurate, because it's not everybody is equally likely to go get blood drawn. People who are sicker or need more health care are probably more likely to get their blood drawn, but it gives a ballpark. And if you look across the country, there some in the range of 15 to 20 to high in the mid-30s% of people have had evidence of infection. The Red Cross also does some similar studies to look at the number of blood donors who have evidence of antibodies against SARS-CoV-2, and varies somewhat regionally, but that's been also in the range of 30 to 40%. So now it seems, almost a year and a half into the epidemic, seems like a fair, reasonable estimate could be that about a third, maybe even higher than that, of people in the US have been exposed. So that gives us some additional sense when we think about how we get to high levels of protection. People, as we've learned, people who have recovered from infection have a protective immune response similar to, perhaps not identical to, the protective immune response that people get with vaccination. So we really should think about both of those populations when we think about what is the true susceptible population. But I think both of those numbers, both of the number of people with prior infection and the number of people vaccinated, if you see on our dashboard, is less than 50%. So the message is there's still a good, very large number of people who are susceptible, who are vulnerable to infection. And so we're not through this yet. We need to continue to pay attention to all the things that we can do to prevent the spread of the virus in the community, and continue to work to try to drive our vaccination number up, because that's the thing that we have control over that is going to result in saving lives from this point forward, is getting as many people vaccinated as we possibly can.
Thank you for that. The next question goes to Sharon Bajenda, CBS 58 in Milwaukee.
Hi there. Thanks for taking this question, and I'm not sure whether or not you can answer it, but Dr. Westergaard or Tracy, how is DHS transitioning to more focused efforts to get people vaccinated? Are there talks about, helping Wisconsin employers who are willing to hold an on-site or off-site clinic for their employees just to kind of raise that vaccination number? Thank you.
Sure. As I think, Julie Williams-Dyke, who's not with us, can talk in greater detail about what our vaccine task force is up to. But yes, they are engaging as many partners as we can, including large employers and small employers, school districts, healthcare systems, to try to continue to build infrastructure so that vaccination is easy to obtain for everyone. I think there's been a lot of progress developing a system and an environment right now where anyone who wants to get a vaccine can get a vaccine. So that we're continuing to work on reducing barriers to getting vaccines. And the other piece, and I think all of you in the media are good partners for this, is to work on vaccine confidence among the public by telling the stories of people who've become vaccinated, by sharing the best science to instill confidence that these vaccines are highly effective and highly safe. That's the work that remains to be done. Is we've got good supply of vaccine. We need to promote confidence in the vaccine process and the vaccine product so people can understand that they're highly efficacious and safe, to get more people to get vaccinated and feel confident about the protection that it provides.
Thank you for that. Let's go now to Katie Crowther, TMJ4 in Milwaukee.
Hi, Hi, thanks for taking this call. I was just stemming off that last question. A lot of other states, even neighboring states like Minnesota, offering some big incentives today. As we know, Ohio already offered, $1 million giveaways for people to get vaccinated. The U.S. Treasury Department saying that is okay to use for federal COVID-19 relief funds. Will Wisconsin consider anything like that as more states are doing it and seeing results?
So those are great questions for our policy team, and I think we'll make them available. I agree. There's a good public health literature that incentivizing healthy behaviors is effective, and it's we have this is a good strategy, and whether and when Wisconsin moves into that space is a question for some of our policy team.
Thank you for that. Let's go now to Jessica Garaci, Spectrum News.
Hi, thank you for taking my question. I believe early on in the pandemic, the benchmark of 2 to 3% positive was considered the benchmark of the pandemic being considered under control when we had a 2 to 3% case positivity rate. It seems like we're about to that level in Wisconsin. However, 57 counties still have that high disease activity level. There's only, this data shows 42% of people or less are vaccinated. I guess, how does DHS want people to interpret this data in understanding the disease level when it is still really high per your data, but yet the case positivity in that percentage is low? How should people kind of how does DHS want people to interpret that data when they see this updated every day?
Well, I can start from my perspective as someone who's thought about this and looks at the data a lot. And Tracy, if you have things to add, you can. I think the elements that are on that dashboard are, in my opinion, like the totality of sort of the high level parameters that we need to look at. There's no one piece of data that tells the whole story. You need to look at it from different perspectives, and I think the summary dashboard really does that well. The disease activity level is disease activity level, and we feel like that is meaningful. So when we say 57 counties have high disease activity level, that's high. We want all counties to have low disease activity level. So if their majority of counties have high disease activity, that means we have more work to do. We've also set a goal that we want 80% of people vaccinated, so that we're at low 40% of people have been fully vaccinated. That's not high enough. So the percent positivity specifically reflects both the amount of virus that's spreading and the number of people who are getting tested. And right now there's still good numbers of people who are getting tested because they're symptomatic or they're exposed. The percent positivity tells what proportion of those have SARS-CoV-2. There may be other respiratory viruses spreading. I wouldn't say that 2.3%, which is what the live version of it says, is acceptable. I think we want it lower than that. We want it to be less than 1%. But it's really all of these things together that tell the complete story. And I think it's good to have goals. And I think our goals are to have low case activity in the entire state and to have 80% of people fully vaccinated. And when you keep those goals in mind and you look at our dashboard, you can put in perspective that we still have a good long way to go.
Thank you for that. Let's give the next question now. PBS Wisconsin, Will Cushman, PBS Wisconsin.
Hi there. I am wondering, you mentioned a little bit ago some of like the data cleanup that you're working on right now, specifically confirmed cases in group housing, then also cases by race and ethnicity. I'm wondering if any of that data cleanup is also related to deaths, and if the 37 new deaths reported today, or additional deaths reported today, it seems like a majority of them are maybe from quite a while ago, if any of those are related to any of these revisions with group housing or other areas. Thank you.
Thanks, Will. I will say that those deaths that are there today, the 37 additional deaths, they do go back a bit. They go back to November, so they are a result of ongoing data quality efforts that are happening at the state and local level. And, you know, sometimes those can be a result of, you know, a delay in a death certificate being certified. So we do occasionally get deaths that are reported to us on a bit more of a delay. So that's really what's happening there, and that's an ongoing effort. It happened to be a good number of them that were in the system today, but we're glad to be continuing to count that accurate number of confirmed confirmed deaths and probable deaths as well. So we will continue to update that, but that average, that 7-day average, will show you what are the more recent activity, the more recent deaths, and give you sort of a more accurate picture of what is happening at current times.
Thank you for that. Last question to Wisconsin State Journal. This is our, we'll try to go back to some of the reporters we did not get to, but Wisconsin State Journal.
Yeah, hi, thank you. I just wanted to ask sort of a broader version of maybe some previous questions. Given that, you know, the cases and deaths are down, but vaccination is not as high as desired, and the few remaining mask mandates and COVID restrictions like in Dane County and Milwaukee are about to go away. Can you just give an overall assessment of where we are at in the pandemic right now? Much of the public seems to think maybe it's over. Are we close to it being over? How concerned should we still be?
I think it's a good question, and these are sort of impressions and opinions. When you look at, I think the key number that I base this on is the, you know, now greater than 40, approaching 50% of people who have gotten one vaccine dose. So the fact that we're about halfway to our goal, or more than halfway to our goal of getting the population high levels of vaccinated, and our cases that are at a level they were a little bit lower than this time last year, you know, in many ways, we're in the best place we've been in a long time. The disease circulating in the communities is lower. I think people have gotten the message about safer gatherings and gathering outdoors. And, you know, as you said, mask wearing overall is lower, but there are a lot of people who are making good decisions about wearing masks in indoor settings when it's the right thing to do. So all of those things, I think it's fair and it's appropriate for us to feel good and optimistic that we are in a better place. You know, but as I just said a few minutes ago, our numbers aren't where we want them to be. We're not at the, you know, at that level of herd immunity. There's a lot of people who remain vulnerable or susceptible to the infection. And if we don't do things well, if we have large indoor gatherings with unvaccinated people, we're not out of the woods to the point where we could have local outbreaks or regional surges. And, you know, that's the story that's being told globally. You know, the pandemic is not over. We've made a lot of good progress. We have levels of protection, meaning immune protection from vaccine and natural infection, that are higher than we've ever had. So we should, as Tracy said at the beginning, be proud of our response in many ways, but we should also be honest with ourselves that the pandemic is not over. It's not over, you know, in this country or any other country, and so we should not stop trying. We should not ignore what we've learned or discount the lessons we've learned about how to prevent vaccine, and continue to be diligent.
Thank you for that. We do have some reporters that we tried to get to and who were not available when called on. So let's go back and just see if they have joined the call since then. We'll start with WBAY TV in Green Bay. WBAY TV. All right, how about Associated Press? Associated Press, are you on the call? *6 will mute and unmute your phone.
Hi there, this is Todd from the AP. I just got on, but I have no questions. Thanks.
All right, thank you for that, Todd. Let's try now Fox 6 in Milwaukee. Fox 6 in Milwaukee. All right, and what about WMTV in Madison? WMTV in Madison. All right, well, with that, we will wrap up today's briefing. We want to thank Tracy DeSalvo, Dr. Westergaard, all of you for participating, and we ask you to continue to monitor the DHS COVID-19 web pages for data and guidance. You can find additional information on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.